We are live again.
Yay! Yay!
We're getting there with
Hurrah!
our social media skills. Okay,
Yeah.
so hey everyone. Thank you for joining us for our fourth self-care session. Our last session was with yoga teacher extraordinaire Marie Tay, and that was really well received. So if you missed it, do feel free to go back and check it out on our YouTube channel. As always, today's session will consist of three main sections. So we'll start with a chat with our special guest today. That is Joyce Connor. So we'll be talking to her about various things. So she is a makeup artist and a skin care specialist. After that, we'll move on to a demo of a self-massage and stretch routine, which will focus on an area of the body chosen by our guest this week. And then we'll finish with a bit of time for questions. So if you do have any questions for either ourselves or for Joyce about skincare, about massage, or about the causes that Joyce will be speaking about, please feel free to send them to us. If you can't check in with us live for the stream, you can always send them to us afterwards and we can pass them on and relay any answers to you. So Joyce, let me tell you about our amazing guest. Joyce is an international award-winning makeup artist and a skin expert. She has 20 years experience. She specializes in hair and makeup for weddings, for fashion, for corporate events, and for special occasions. And she also offers online makeup lessons. Like many of us at the moment, she's had to revert to technology. So she's offering these amazing tutorials on skincare and makeup. Joyce is based in Berkshire in England, but she travels nationally and internationally for her events. And she has worked all over the UK. She's worked in Cuba, Canada, Greece, France, Italy, and many other exotic, lovely places, which I'm sure we're all desperate to get to at the moment and will do when we can. Joyce speaks regularly on BBC Radio and writes for online and print magazines and newspapers. She is passionate about education. She completed her own education in UK, then in New York, and then in Paris. She also has a really strong community spirit and loves to give back. So she is a regional coordinator for the cancer charity, which is Look Good, Feel Better. And she also today will be talking to us about a very special charity close to her own heart called Cianna's Smile, which deals with sickle cell awareness and support for anyone who might have sickle cell in their life. So you'll see our PayPal link, which was up earlier, and we'll pop that up again on our comments. If you can make a donation, that will be really appreciated, and any donation that you make will be split equally between ourselves at Pommel in Need, our guest, and her nominated charity. If you can't, that's absolutely fine. We understand that you might not be able to, or it might not be for you. If you can't, if you can just amplify ourselves and Joyce and the charities on social media, that is also really appreciated and goes a long way to spreading the word. So I'll tell you briefly about Joyce's charity. So Cianna's Smile offers support and education to families who are affected by sickle cell anemia in the UK. This is a life-threatening genetic blood disorder. I didn't know much about it myself, and Joyce will tell us a bit more about it later. But just to let you know, it is estimated there are approximately 250,000 carriers of the sickle cell gene in the UK, and over 15,000 people with sickle cell anemia. And it has some pretty awful side effects that affect families. And so the point or the purpose of Cianna's Smile is to spread awareness, to spread education about sickle cell anemia because it's not widely known, and also to offer support for families who might have it in their close circle. So Joyce will tell us more about that later. I'll stop waffling, and Lucinda, how are you doing this week?
I am very well, thank you. Very well indeed. I'm happy the sun is shining and we're having a summer at last. It's come back.
So might feel a bit shiny, but it's all good.
Yeah. We're always shiny on these things. So people are used to our shiny faces.
Glowing.
So
Have you started back with massage, Lucinda, yet, or what's your situation?
So it's an interesting one because, again, us as Pummel and Need, we haven't, because myself and Claire, Pummel and Need, we're corporate massage. So we go into office spaces, and I think we've told you this before, but we offer sort of our sports massage treatments in a corporate setting. So unfortunately, that is still non-existent at the moment because so many people are working from home. But very sort of excitingly, I have started doing a few private clients at home, which is absolutely wonderful. I mean, it just feels so liberating to be able to do what we train to do, even though obviously it's a very different. Well, actually, I say it's a very different type of practice, but it's not that different. I was a bit worried starting because I only started this week because of obviously all the PPE we've got to wear and things like that. But so far, so good. So yeah, I've done the odd one or two.
Amazing.
So, yeah,
That is
it
a relief. I'm sure it's a relief for your clients as well to be able to have a massage.
Exactly. And it's not, I think if people are worried about safety, having a treatment, then it's, I can show you, I mean, I've got some things here. We feel like we're completely sort of like little Darth Vaders, but we wear the mask, and then we have the screen like this. So
without the headphones, though.
No, I might wear the headphones just for a laugh, but no, little Darth Vader, but nothing is coming through this bad boy. So it's actually, it feels really protected, and we've been given guidelines by our sort of unions to tell us how we need to prepare the room, sterilize the room. We use disposable sheets, so you're not using other people's sheets. So it feels really, really protected and safe. So I would say anyone who is a bit worried about having a treatment, because I myself, I have to admit, was a bit worried starting the treatments because I thought, how is this going to work? But actually it feels practically normal. The only difference is obviously wearing that PPE, but everything else feels really normal, really natural, and still a really nice therapeutic treatment to have. So I can honestly say that I wouldn't worry if you're thinking about it for a bit unsure of whether to go for it yet or not, because it feels safe.
Oh, fantastic. Yeah, that's a really important message to send out to people, I'm sure, because you can understand, why people would be a bit reticent. So it's nice that you can go, we're doing everything to keep, I think the hygiene practice within massage and beauty and wellness generally tends to be quite rigorous already. And we just have to go that extra mile now and, mask ourselves up like Darth Vader, as you say.
Yeah, those things weren't designed for people with fringes. That's all I'm saying.
God.
I've got like by the end. I mean, it's a good look. I feel like I'm really rocking the look at the moment, but priority to keep people safe. So that's
absolutely fantastic. Lovely. Well, Lucinda, we will bring in Joyce now, and I will let you have a little break if I can. There we go.
Yeah.
Hello, Joyce.
Hi.
How are you doing?
Yeah, good. It's a lovely day today, so that's a nice thing. A positive.
Absolutely. Very positive. See you later, Lucinda. All right, Joyce. Well, I gave you a brief introduction there, but would you like to tell us a little bit about yourself and your work and how lockdown has impacted your industry over the past few months?
Well, gosh, lockdown was such a huge shock for me, really, because one day we were working and then the next it was like at midnight tonight, that's it, no more work. The date 23rd of March, I am not going to forget that in a hurry, but slightly before that there were warnings, that people weren't allowed in big groups. I had some shoots booked in that were quite a few numbers. So they were slowly cancelling because events were cancelling, conferences were cancelling. So I knew that it was going to happen. And then I actually decided to, the first few days were difficult. The first few days I thought, it's only 3 weeks, because that's what we were initially told. It's only 3 weeks. We'll be fine. In 3 weeks' time, I'll be back to work. And I also had a holiday booked to Bali. So I was thinking, yeah, that'll be fine. And then you could see as time went on, the numbers were getting higher and higher. And it was a really difficult situation. And I felt like, what am I going to do? What can I do? So obviously I turned to online. Zoom became part of my life, really. And lots of my friends were doing Insta Lives. I was watching those. I was doing courses, learning things. And then I started teaching people myself, started doing online workshops, online makeup lessons. It's proved quite well, really, and doing my own lives to talking about skincare and makeup. And for the first time ever, I did a YouTube video, so I was really proud of myself.
Amazing. Yeah, you've got to just kind of evolve and adapt, don't you? Otherwise you get left behind pretty quickly. So we've all had to make friends with technology, even if we didn't want to necessarily. Yeah. Oh, fantastic. And in terms of your tutorials, if anyone was interested in learning about skincare or about makeup or any of that, how would they go about getting in touch with you, or how does that work? Do you offer them scheduled, or are they one-to-one?
They're usually one-to-one, but I've done a few group ones as well. So people can contact me. They can email me. My email's at the bottom of this video. Or they can message me on Instagram. I'm just at Joyce Connor Makeup. They can contact me there and discuss, their issues, their skin issues. I talk about the skincare routine. What are they doing now? What I can help them with. Lots of people have cupboards full of either makeup or skincare, and they have no idea how to use it. So that's me. I'm their problem solver.
Disappeared. No. Technology.
There, sorry.
Yeah.
No,
I think.
I'm the problem. Oh, was it? Oh, okay. So I'm the problem solver of the the drawers full and the cupboards full of skincare and makeup.
Fantastic. So if anyone has got a similar issue of a cupboard or drawer full of things and they've got no idea what to do with them, Joyce is your woman.
Yeah.
And Joyce, we know that obviously in the UK, you were supposed to be able to start on last Saturday, with Makeup Again, and overnight the whole thing was called off again. So what is the current situation for you guys in terms of going back to work, and what people might expect if they come for their first appointment for a facial or for a makeup?
Well, at the moment, it's still nothing. I mean, we had less than 24 hours notice. I had a full diary for the next 2 weeks of facials and makeup jobs, weddings. Weddings are my biggest part of my work. And just the amount of weddings I've lost this year has been unbelievable. The brides, I feel bad for them because I've booked in some brides for their trials. Their weddings are next month. I'm not sure they're going to go ahead, because not only did he cancel makeup, he also cancelled having 30 people at your wedding. So anyone who had their wedding makeup booked and their wedding reception booked suddenly lost it overnight.
It's terrible. It's really bad. I mean, of course, at the moment there are other things going on in the world, and we know that, things can always be worse, but it is all kind of, each individual person is entitled to feel their own feelings and go through their own problems. And, if you've been planning a wedding for a long time, it must be really devastating.
Oh, it must be. I can't imagine how these brides are feeling, because it's such a horrible thing to go from, and not only that, you can't have any family members from abroad travel in. If you have family abroad, you can have a close amount of family there, and even they have to social distance in some venues. They all have to sit 6 feet apart, no hugging, washing your hands before and after exchanging rings. It's just not the same, is it? It's not the same. Yeah, it just doesn't sound right. And I mean, most couples are already living together, so the fact they're asking them to wash and sanitize their hands before exchanging rings is all a bit strange.
Yeah.
To me, it's some of it just seems to be plucked out of the air. But I do understand, as a makeup artist, I am facing my client, and I am in their breathing zone for a full 60 minutes, roughly. If I'm doing a wedding, it takes me about an hour. I do have to, like Lucinda, I have got one of my visors. I've got face masks. We've had to change the way our kit is. So our kit has to be sanitized. If you use something, you then have to put it into the used bin. Well, not the bin, but, you know, a used container that's sealed. All the brushes have to be washed, which I do anyway. There's a lot more to our job roles than we used to have before.
Yeah, things are definitely changing. It's there's a lot for people to get used to. I think in pretty much every job that anyone's doing is a serious amount of change happening that will take time for people to get their heads around. And of course, you know,
Yes.
we'll make mistakes. Human error happens, and I think we all just have to be as rigorous and as careful as we can be, but also have a bit of compassion for each other when we're maybe not getting things 10 out of 10.
Yeah, exactly that. But I've noticed that this week it is now compulsory because it wasn't compulsory for your client to wear a mask, but from Saturday it's compulsory for the client to wear a mask. Well, obviously, if I'm doing someone's makeup, they can't wear a mask.
No lipstick.
So, I'm not sure how that will work. And we just don't. You couldn't have imagined at the start of this year, when I was reading about coronavirus or COVID-19, I thought, oh, well, it's in China. And then when it came to Italy, I thought, gosh, you know, it's in Europe now, but still never imagined that we'd get it, because you don't really think of it being all over the world like it is now.
Yeah.
And it's strange times, but we have to adapt. You know, that's why I've adapted to being online. Some people don't want to be online. Some weddings have taken place online. Even TV and film stopped.
Yeah.
TV and films stopped because the makeup, and now there is an option to direct my model to do her own makeup, but I'm not sure how that will work. I haven't been asked to do that yet.
I'm not sure how I'd cope with that. Wow, God, that's amazing. Yeah, no, it is definitely a time for change and adapting. And Joyce, so I met you, I think 7 or 8 years ago. That might be wishful thinking. It might be even longer.
I think it was 2012.
We'll go with that. We'll go with that.
Yeah.
And I was your demo model for the BabTac Awards at that point. And so that, I mean, when you think about where the world is going and how quickly things change, I just wonder, from your point of view within the cosmetics and the skincare industry, do you think things have changed a lot in terms of inclusivity and diversity across the board? You know, I think there's been a lot of campaigns for inclusivity with aging, for example, you know, not just having 19-year-olds, you know, showing their perfect skin all the time. So what is your take on that, or how do you feel it's moved?
Definitely, things have changed quite a bit. I mean, you'll see some of the big brands, L'Oreal, Lancôme, they're using more mature They're trying to be more inclusive by using different skin tones, different ages. Instagram changed things a lot because Instagram sort of came in after that, didn't it? So it's the way, but it's still, for me, it's still an illusion of makeup. It's not real. And also you had the biggest change, I think, was the Kardashians coming into the makeup world. They actually, everyone then wanted to look like them,
Right.
because they thought it would make them famous, and so everyone wanted contour, highlight, and you saw that things changing in that way. People started to educate themselves a bit more, but it's a guessing game still. You know, if you walk into anywhere like a big Boots or a department store, you'll see there's so many more makeup counters, there's so many more makeup brands, there's so many more skincare brands. So it can be confusing for anybody to think, oh, which one shall I get? And, you know, this person has this makeup on this Instagram picture or this Instagram story. Oh my God, I'm going to buy that because I'll look like that. As we know, it doesn't work like that, Claire, does it? Because
No.
it's trial and error and finding out what's right for that person. It's education is important. It's educate yourself. Think about something. You know, if you see something you think, oh, I really like that, will it look right on you? You need to go out and check it, try it. Well, you can't try now because all the department stores are removing all the makeup, so you won't be able to try anything. But it's just getting a rough idea, and like that's going back to having cupboards full of makeup and skincare that might not have worked because either they haven't used it properly or they're not sure what to do once they've bought it. They've got the product. But in terms of inclusivity, now you see disabled people modelling. There's that girl whose name's gone out of my head, she's got Down syndrome, and she's a London Fashion Week model. You're seeing more of that. You're seeing all different skin tones on the catwalk. You're seeing transgender on the catwalk. There's a lot more, and sizing, different sizes. Things have changed a lot because people want to see that. They want to see real. They want real life, and they want to be able to relate to those people they see in magazines or online.
Absolutely. And do you think, in terms of like the products that are available to you as a skin specialist or a makeup artist, is there a greater range that suits a greater range of skin and hair types now?
Yes, definitely. There's a lot more available. I used to go to New York every year just to get products that I couldn't get here, because it was quicker for me to go there and buy things. And buy up skincare, especially makeup, because makeup for darker skins here in the UK is really difficult to find. But now there's so much more available. Same with the hair, and I love skincare anyway. But my favourite skincare brands are Japanese and Korean, because they have really nailed it. They've really nailed the skincare brands, and there's lots of people that don't really understand what products do. They hear an ingredient name and then they just think, oh my God, that sounds amazing. But there's a lot more to it than just a name of an ingredient. And also, where does it come on the ingredient list? Ingredients are quite, leave that to the experts, I would say, because you're not really, it's not as simple as saying, like, one of the top buzzy ingredients is retinol. But a lot of people think, oh, I'm going to put retinol on, and then suddenly they realise that actually it's causing skin problems because they're not using it correctly. So if you wear retinol, you have to wear an SPF. And that's not just in summer, you have to wear it in winter. You need to protect your skin because it's a super exfoliator. And what could happen is it can cause surface capillaries, or it can cause hyperpigmentation. So you end up with brown marks, or hypopigmentation, vitiligo. So you need to just be really careful when using these potent strengths of ingredient on your face.
Yeah, absolutely.
Yeah.
I think we chatted about it earlier, and across the board, I think it's so dangerous, whether it's putting something into your body, or, you know, putting something on your skin, or, you know, choosing how you exercise, or whatever it might be. You know, if in doubt, go to an expert rather than just looking at someone on Instagram who looks a certain way and you think, if I apply this product, that will be how I look. And I think it's, you know, I think there seems to be now a bit more responsibility around it, with people seemingly being a little bit more honest. But I think still, you know, there's a reason why people like yourself educate themselves and become experts in a certain domain, so that you can then prefer the advice to people who need it. I think there's people want a quick fix, and actually there's no such thing as
I know, who doesn't? I mean, if you wake up with a big spot here, you're going to try, you know, people put toothpaste on, or all kinds of things, some remedy that their grandmother had, and they're trying everything, and it's we want a fix now because we're used to fast solutions. We're used to things being immediately fixed, or corrected, or you take a picture, you put a filter over it that hides your lines and wrinkles and all the rest of it. But in reality, it's not like that. So we just need to slow down, and during lockdown, that's what I've learned. It's all about thinking. We've got time to think now. We've got time to learn. We've got time to be more open, and also the biggest thing is helping others, helping other people through their difficult times. But with skin, my motto is great skin is everything. So if you have good skin, then the makeup is second to the good skin. So you can't just keep covering up with makeup, especially in this 36 degrees tomorrow. Wearing a full face of makeup is going to be difficult. So it's all about treating the skin. Treat your skin well, get your skin to its optimum, and then you'll see that the makeup comes in second. It's not so much a mask, but it's an enhancer.
Right. Yeah. That makes sense. Yeah, fantastic. And Joyce, I know a lot of people, you know, certainly with myself and Lucinda, a lot of people have struggled with not being able to have massage during lockdown, and I know that, you know, a lot of people have not been able to have a haircut, and we've all seen the terrible lockdown hair. People have even been doing their own like home dentistry if they've had tooth problems, which again, my network is dreadful today. A lot of people have not been able to have their normal skin care routine, you know, people who might go for facials, or people who might be having a certain type of treatment. Would you have any advice to give to anyone who might be, you know, stressed about how their skin is coping in lockdown? And also, because people are wearing masks now, there's this new maskne people are talking about. I don't know if that's a real concept or not, but what would you say to anyone who's stressing out about not being able to have their usual skincare?
Well, there definitely is a lockdown skin, and most of people's problems is down to stress. Even though we might not feel the stress of tearing our hair out, we are stressed because we're in a situation we're not used to. So our skin breaks out. So if you take someone's face as a whole, in the same way that we have reflexology, our face shows parts of the skin. So you've got your stomach, you've got your elimination, you've got your hormonal ovarian testes here, you've got your lungs around the cheeks, liver, the intestines are here, and then we've got our stress zones. Our stress zones are along here and down here. So wearing the mask, your face is sweating. We've been taught to wash our hands for 20 seconds. We need to wash our faces for at least 60 seconds. That will help. Also, I know a lot of people, I've got makeup on at the moment, but normally I don't put any makeup on because I'm not going outside. I'm wearing less makeup. So the skincare side of things tends to lapse, doesn't it? You think, I don't need to do my skincare. I haven't got any makeup on. Do you see the kind of differences in that sense, that we're caring less, we've got less care, and we'd rather lie in front of Netflix all day than do the skincare?
Absolutely. Yeah, no, that makes absolute sense. It's so true. I think because so much of our self-care is to do with our sort of external affirmation. So we make ourselves look nice because we're going out seeing people, and therefore you take care of yourself because you will be potentially judged or affirmed by other people. And that's, I suppose, really relevant and really kind of on brand with our self-care series, that, even if you're not going anywhere, take the time to look after yourself, get up in the morning and wash your face and put on a bit of moisturizer.
Yeah. Moisturizer is one of the most important things, because, but internally too, we need to look after ourselves internally. And I'm guilty of it. During lockdown, sometimes I'm bored. So what do? I snack. And all that snack, we should be snacking on fruit and better things than a bar of chocolate. But we need to look after our stomachs, and we need to increase the amount of water that we're drinking, because even though we don't feel like we have to do these things, we should be doing these things. We need to take care of our internal selves, our stomach especially. Your stomach is the root of everything. So if your stomach's healthy, you should feel healthy generally.
Absolutely. Yeah, there's a lot more focus on gut health now, and I suppose use your gut instinct and look after yourself, and hopefully the inside will be reflected on the outside.
Because we have worried, haven't we? It's natural to worry. I've been worried about, when am I going to be able to work again, and when I do go back to work, is it going to be safe? Those sorts of things worry. So then you start thinking about it more, and then you can't sleep, so that's another thing, and it's like a roller coaster.
Absolutely. Yeah, no, that's really interesting. Thank you, Joyce. So moving on, I'm conscious that I'm waffling as I tend to.
I'm a waffler, don't worry.
I would love to hear about your work with Look Good, Feel Better, which is one of the many strings to your bow. What does Look Good, Feel Better do, and what is your role with that?
So my role as the regional coordinator is I run workshops for women with cancer. Look Good, Feel Better also has workshops for men, and they have workshops for teenagers as well. But I just do the women-led ones in my area. I do Reading and Newbury workshops, and usually we have a room of 12 ladies, and I have other volunteers with me, and we teach them how to do their skincare and makeup. They've lost their eyebrows, they've lost their lashes. It's a fun 2 hours of lifting them up and not speaking about cancer, making them feel good. And it's true, they look in the mirror and they think, I feel so much better after coming in, and they've lost their hair. Most of them will think, I'm taking my wig off, or I'm taking my turban off, and they feel amazing afterwards because they've not had to think about their treatment. And it's a fantastic thing. But like with everything during lockdown, even that's online now as well.
Oh, of course. Yeah. Wow.
Yeah.
I mean, I, s- I would think, I don't know, but often with groups, one of the things, aside from what you learn, but one of the things that's really nice is the social aspect of talking to people who might be in a similar situation to you.
Yeah.
So that must be really nice for people as well, to be in a room where they know everyone else kind of gets it, that you don't have
Yes.
to hide it or explain it or justify
Yeah.
anything.
That's right. And the other thing is, some of the ladies, they exchange phone numbers and they become friends. And occasionally, because I teach at the local hospital, I'll bump into people and I don't recognise them because they've now got a full head of hair, and they go, "Hi, it's me," and it's so lovely to see some of them years later, or stay in touch with them. They contact and they write lovely things, and it's such a nice thing to do. So we do fundraising. I do fundraising for them as well, but that's again quite problematic because we can't do the races and tea parties and baking and stuff like that. So people they're trying to fundraise by getting people to donate anyway. So it's quite a good thing.
Okay, that's fantastic. Yeah, I know charities have really struggled during lockdown as well. It's part of the collateral damage, I suppose, which is a shame. And that brings us on to your other cause, which is this week's cause, which is Cianna Smile. And if, like I said at the beginning, if anyone's able to make a donation, a portion of that will go to Cianna Smile. And I know this is very close to your own heart, Joyce. Can you tell us about Cianna Smile, what it is and what its purpose is?
Yeah, so Cianna Smile is named after my granddaughter, who is Cianna, and she was born at 29 weeks. She was premature, 11 weeks premature, and she was diagnosed at birth with sickle cell anemia. So sickle cell anemia is a genetic blood disorder, and I myself am a carrier. I've got sickle cell trait. So even though I haven't got the disease, I carry those blood cells. So I've passed those blood cells on to my daughter, and my daughter's partner, who had no idea that he had those blood cells until after it was too late. I think my daughter was about 6 months pregnant. They said to him, "Oh, you've got sickle cell trait as well." So what happens when two people who have the trait, who are carriers, genetic carriers, 1 in 4 of their children will have the full-blown disorder. One child will have nothing at all, and 2 will have the trait, so that 2 will be carriers. My daughter said, because there didn't seem to be enough help locally, localized help, because there's national help, but she wanted to set up something, so she set up a local charity for the Thames Valley area. So it covers quite a big area, although people from West London's kind of squeeze in there as well. And we help the family. So it's all about children, helping people with children who've got sickle cell as a support network, and raising awareness in schools, speaking to doctors and nurses. Some doctors and nurses don't even know about it. So she goes around, she does talks to businesses, because some people's businesses have staff, and what happens is, when you have a sickle cell crisis, all these crescent-shaped blood cells can't pass through anywhere that's bendy. And as a massage therapist, you know, bendy parts are everywhere.
Yeah.
Neck, wrist, elbows, shoulders, knee, groin, back, the vertebrae, everywhere is bendy. So all these blood cells clog up and they cause intense pain and fatality. You know, my cousin at the age of 8 passed away because back then they didn't really know much about it, but things have advanced so much. There are ways and techniques to help with the pain. They have pain control. It's such a wonderful thing that my daughter's doing, because she has raised so much awareness that people now know her. She's even connected with someone in America who found her on Instagram and said, "Oh, my little girl's got sickle cell and she doesn't know anybody else." And so it was a lovely thing that she connected with this child who wanted to speak to Cianna, who she saw as like a big sister. So it's getting people, you've learned something about it, haven't you? So it's making people aware, and even though it's genetically more in Africans and Caribbeans, there are some other people who carry the trait. Because unless you know your full history, somebody from a couple of centuries ago could have that trait and passed it silently down the generations that you didn't know about. They actually found a family that lived in the north of England who they'd lived there all their lives for the last 200 years at least, and they all had sickle cell trait.
Wow, that's incredible. Wow.
Yeah.
Yeah, no, I mean, I knew that you were working with Cianna Small, but in terms of general information about sickle cell, I just didn't know much about it at all, and it is really interesting. And what are the sort of how does it manifest in children? What sort of things happens aside from the pain that you mentioned?
Well, it's a silent disability. You don't really know without a blood test what's happening. You don't realize what's so usually in children, children complain about stomach pain all the time, don't they? They say, "Oh, my tummy hurts," or they've got a headache, or they have lethargy, and you can tell, you can see it coming. A temperature, a cold can suddenly become pneumonia. It's very quick, rapidly. So Cianna had to have her spleen removed because hers manifested in her spleen all the time. Her spleen increased in size constantly until it wouldn't shrink back. So she's now got that no spleen, which means she's immunity compromised.
Oh, wow. Oh, well. Yeah. I'm really glad that we're able to talk about it today, and hopefully some of the people watching will go and look up Cianna Smile and find out a bit more about it and about how you can help. I know I saw that they have an art box. Yeah, what is that? Can you tell us what the art box is?
So the art therapy boxes, we did a fundraiser for the art therapy boxes, and it's for children who are in hospital having a crisis. And art therapy helps. It helps the children. It takes their mind off the pain. So we make up these boxes and we send them to all the hospitals around the area for the children to take home with them, so that they've got something to do when they're stuck in hospital, away from their family and friends. And at the moment you can't really have any visitors.
Yeah.
So it's nice to have something to do.
Fantastic. That's amazing. Yeah. So if somebody wanted to go on to Cianna Small, they can check out all of the ways that they can help out, or how they can amplify it or contribute in some way.
Yeah, definitely. They can go onto Instagram, the Cianna Smile, and the Facebook page of Cianna Smile as well. So it's the same across the board. And it's lovely to just help recognize, and they might know someone that's got it, so it's good to understand it for that person's benefit.
Absolutely. Brilliant. Thank you so much, Joyce. Thank you for your fountain of information and knowledge which you've passed on to us today, and for talking about Look Good, Feel Better and Cianna Smile. So we're going to bring Lucinda back in, and I'll let you go backstage for a bit. If anybody has any questions for Joyce, please feel free to pop them in the comments, or you can always contact Joyce. We have her email address and her website. Which will come up.
Can I just say hi to my friend Alan, who's watching? Very supportive friend.
Amazing.
Thank you,
Hi,
Alan. Yeah.
Fantastic. And Joyce will bring you back on in a few minutes once we've gone through a quick massage demo, which will be focusing today on the neck bring Lucinda back on. Hello.
Hello. How are you doing? That was brilliant. How interesting. I didn't realize that I should be washing my face for 60 seconds. Maybe that's why this has appeared. Because I'm not. I've got my mask acne, or whatever you call it, maskne. Oh my goodness, that's what's happened to me. So yeah, amazing, really interesting, and Cianna's smile sounds such an inspirational charity. So that's really worth having a look, everyone, if you can. So we're now. Sorry, Claire. We're now going to move on to the massage section, self-massage and stretches. And I think Joyce has mentioned that she struggles a lot with her neck and shoulders because when you're a beautician or a makeup artist or anything like that, you do, and the same with us actually, massage therapists, we do a lot of sort of leaning over. So you get a lot of tension in the neck and the shoulders, and also office workers constantly struggling with things like this. So this is a great area to recap because I know a lot of people struggle with this area. We're also going to have a little look at the jaw, which we haven't touched on before. And this is because quite a few people struggle with jaw tension, and a few people struggle with jaw tension and don't even realize, and it can lead to tension headaches. It can lead to things like tinnitus, also, again, neck pain. So it's worth bringing in a few jaw stretches and exercises as part of the upper sort of neck and back routine, because it's all connected. So we're going to do a couple of jaw things as well, which we haven't done before. But the first thing we're going to do, just to get ourselves into this self-massage routine, is we're just going to concentrate on our breathing. So I'm just actually going to mute you, Claire, quickly, because Claire's going to demo and I'm going to talk through, but I end up demoing most of it anyway because I can't help myself. But we're just going to start off by taking nice breaths in through the nose and out through the mouth. And what we want to try and do is breathe in and out from our diaphragm. So the diaphragm is just below the ribs, and we want to imagine that we're sort of inflating and deflating a balloon. And this is just to really slow down our breathing. So we're not breathing this shallow breath from the chest. We're breathing these slow, deep breaths in and out from the diaphragm. And the reason that breathing is so important is that on our out breath, we actually stimulate the parasympathetic nervous system. And the parasympathetic nervous system is actually our relaxation response. So we want to really just bring the focus back to the breath and just have a bit of time for ourselves, just breathing slowly and deeply. Great. Well, I know it's a kind of, we're moving on quickly, but I hope you're already feeling the benefits of that breath work. And then we're now going to do our first stretch. So we're going to do a lateral neck stretch. So what we're going to do is we're going to tip our left ear to our left shoulder. We're just going to gently tip. And to increase this, what we're going to use is the right hand. We're going to point down to the floor, or if you're on a chair, you can grab the chair to add a bit of traction. And this just increases the stretch on the neck. And as you can see, Claire is popping her hand on the top of her head, because you can increase the stretch further by using the opposite hand to just add a bit of pressure. And you don't want to do any yanking or sudden movements. You just want to use the weight of your hand to increase that lateral neck stretch. And you hold this for about 20 or 30 seconds. And after you've done that, just bring your head back to neutral slowly, and we'll do the opposite side. So now we're going to tip the right ear to the right shoulder. Again, using the left arm to point down to the floor or grab onto a chair that you're sitting on, and then use the opposite hand to apply a little bit more pressure just to get a deeper stretch in that neck area. And again, just hold it 20 to 30 seconds. Remember to breathe. I often forget to breathe when I'm doing these things. It's so important to remember to breathe, because that's part of the relaxation process, and the muscles will loosen up more easily. Okay, we're going to move on to one of our first jaw exercises. Now, this one is a resistance exercise for the jaw, which sounds a bit strange, but basically it will help to strengthen, stretch, and relax the jaw. So it's fantastic because it works everything. And what we're going to do is we're going to place our thumb underneath the chin. I don't know if you can see that. Perfect. And then you open your mouth slowly, and at the same time you push up with your thumb. So you've got the resistance of your thumb pushing upwards and you trying to open your mouth downwards. Now, don't do it too strongly so you hurt yourself, but you hold this for about 5 seconds and then you slowly close your mouth. And you can do this 2 or 3 more times, and it's really great to strengthen but stretch and relax those jaw muscles. It's a fantastic one. And if you suffer from things like TMJ, which is all to do with the jaw tension or misalignment of the jaw, this is a great exercise to use. So the next thing we're going to do is we're going to do a little bit of myofascial release for the jaw. So myofascial release, we're basically trying to release all the fascia and all the tightness in the jaw. And the main thing to remember with this is to be slow. So basically, press your fingers at the back of your jaw and let the pressure of the upwards motion of your fingers glide your fingers up, right up to your temples. So basically, if you get stuck, just stick there for a bit, and eventually the muscle will release and it will allow the fingers just to glide through. And the temples, the temporalis muscle, is also attached to the jaw. So again, it's really nice to stop on the temples and just give yourself a little temple massage as well. And as I said, the slower the better. This is a very slow release. You want everything to just relax. So just, really relax into it and just enjoy it. It's just really nice. You can even go up into the hairline if that feels good, because again, it's all sort of attached, and a scalp massage is really good. So it's all about just being slow. Wonderful. Very good. So that was just a little mini jaw section, but we might do another video on the jaw because there's so much that can be done on the jaw. But we're actually going to move on to the shoulders now. So we are going to do a nice shoulder release by basically breathing in through the nose and squeezing the shoulders up to the ears. And then on a nice out breath, just letting it release. And we can do this 2 or 3 times. So inhaling through the nose, squeezing the shoulders up to the ears as tight as possible. And then an audible release, let everything go and let the shoulders drop. And then just place your hands on your shoulders. We're just going to roll our shoulders forward 2 or 3 times and then roll them back another 2 or 3 times. Great. And now we're going to go on to the massage section, which is my favorite bit. So we usually work on one shoulder and then the other. So start on whichever you fancy, but I'm going to start on my right side. And just remember to leave your arm nice and floppy, so you're relaxing the shoulder and you're not tensing up like this. And we're just going to squeeze or grab the tissue, the lovely fleshy tissue on the top of the shoulder, and you can go right over the shoulder joint into the arm. You can work all the way down the arm, and you can really give it a good squeeze. And this increases blood flow, circulation into the area. It warms up the area before we start to work deeper into the shoulder. So it's really good just to get everything nice and warm before we start doing any deeper pressure. Perfect. So after we've done that, you take 2 fingers. This is my absolute favorite. And we're just going to do little circles, circular movements, again, through that nice fleshy surface at the top of the shoulders. And you can really go for it. I mean, you're in control of your pressure. So obviously you don't want to be tensing. There's a sort of a bit of a myth that the stronger the better. That's not true. It's nice to feel the release, but if you do it too strongly, you'll start to tense. So you don't want to tense. You want to be nice and relaxed, but you can apply quite firm pressure. And if you find a point that's particularly niggly, you can just rest on that point and just add a little bit more pressure, and that will help to release that area. And just avoid any of the bony areas. You don't want to massage on bone. We only massage on the soft tissue. So avoid the shoulder blade and the sort of the front where you've got your collarbone. I forgot the name then. Right, and then we do the same on the opposite shoulder. So we're just going to start off by squeezing through. Really get the blood pumping through the area. Nice, fresh nutrients, getting rid of some of those toxins by getting the circulation flowing. And then once you feel like you've done that enough, you can use your 2 fingers and get into those niggly areas and do some circling. Now you might feel these sort of knotty bits, which feel a little bit like bone, to be honest. They're sort of little grisly knots, and that is actually muscle adhesions, and it's basically redundant muscle fiber. So it's muscle fibers that have become fatigued, usually through overuse, or it can be through injury, and they build up. So it's really good to give these a nice massage to try and break them down a bit, because it's redundant. It just sits within the muscle. It stops your full flexibility in your muscle and your elasticity. So by trying to break these down over time, you'll get better range of movement within your shoulders, and you won't have as much pain, because a lot of the time our muscles tighten up, and it's these knots that cause a lot of the pain, because the muscles tighten up against the knots, and then you get that sort of pressure pain that is so horrible that a lot of people feel in the sort of shoulders and the neck. Okay, so once we've done that, just give your shoulders a little bit of a rub. We're going to, on both shoulders, use our hands like a rake, which sounds a bit weird, but basically we're going to spread our hands. This is another great move. And we're going to just tip your head slightly forward, rake our fingers through all lovely fresh in the shoulders. So we're basically raking. So this helps with the fascia. So the connective tissue can build up and become quite stiff. This is a great way to release that. And it's a really nice technique. And if you feel like it, you can just do it on one side to really get into those, again, niggly areas. And just be careful that you don't go too strong on these sensitive muscles at the front of your neck, because they can be a little bit sensitive. So just again on the top of the shoulders. And then we're just going to finish off with a nice breath in. I'm going to bring those shoulders up against the ears and release with an out breath. And just take a couple of deep breaths in and out through the nose and out through the nose. There we go. I know it was brief. I hope that has helped in some ways, and that your neck and your shoulders and your jaw are all feeling a little bit looser, and that you can use that and as a part, just a little routine. You can do it at your desk. You don't have to have a lot of time. You don't have to be anywhere fancy. You need no equipment. It's just a really easy techniques that you can do just whenever, when you're watching TV or whenever in your lunch break. So thank you very much.
Amazing. That felt great.
So thank you guys. That was I did that routine along with you. Oh, I feel sleepy now.
Was there anything that you struggled with? Anything you'd like us to go over or recap on?
No, I thought I didn't know about the jaw things, which you're right. If it gets stuck, your fingers eventually keep sliding. It's such a good one.
Yeah, exactly. You can be as slow as you like. Yeah, the slower the better, because you're just, the body is naturally releasing the areas of tightness without forcing it. So it's just a really nice way. It's called, the technique's called myofascial release, and it's quite a gentle way just to release sort of tension and pressure in the body.
Yeah, I think we all need that, from bad posture and sitting, and I do actually. I can feel some release already, which is great.
Oh, good. That's good.
Oh, amazing.
Fantastic. Let me just check if, because we did have a few little comments, because we're now open for questions. Samantha Irving says, Joyce, you're so inspiring. So that's a nice comment. There's one question that I'd like to ask from Sarah, and she's asked, can you recommend any cruelty-free skincare products, the best cruelty-free skincare products? I'm presuming she means animal cruelty.
So all skincare brands in the UK, in Europe, have to be cruelty-free. They cannot be tested on animals as part of an EU directive. So anything you buy, but there are some brands who sell in China, and it's not the brand that's testing, but China tests their products. So it's quite difficult scope of, there's cruelty-free and there's vegan. They're two separate things. But also it depends on what her skin needs. So it's best for her to contact me, because then I can talk about her skin, and then I can recommend some brands to her that will help.
Great. Okay, no problem.
Awesome. That's a good question. I didn't know that about Europe having this directive, but of course there's always a loophole, isn't there?
Oh yes, there is. And of course we'll be leaving the EU, so who knows what's going to happen. I know. There are certain things that, the leaping bunny is something to look for on products, because not everyone is on the Leaping Bunny website, but the Leaping Bunny website does tell you which brands have been vetted to say that they are completely cruelty-free.
Ah, okay. We'll post that then in our comments afterwards.
Yeah, I'll post that now.
Brilliant.
Yeah.
Awesome. Was there any other questions, Lucinda, that you noticed, or anything burning?
No, just lots and lots of positive comments.
Oh.
Alan has said Joyce is brilliant. Heart, heart.
Oh,
Yeah, you've got lots of positive comments. So thank you so much.
Thank you so much, Joyce. That's great. And again, everyone, as we said before, if you have any questions, you can always contact us afterwards. You've got Joyce's details up there, and you can contact us, and we can always pass anything on as well. And check out Joyce's website. She's got some amazing ideas and beautiful photographs up there as well, so you can have a look at those and see the evidence of her work.
Oh, thank you so much, Lucinda and Claire, for having me. It's been amazing. Even I've learned something new tonight, how to care for my neck and feel good for once.
I am 100% washing my face for 60 seconds tonight.
Yeah.
For now and forever.
Absolutely.
Yeah. Oh, there's one more tip about cleansing that most people don't know, and it's a tip that everyone should take care. So you should always cleanse your skin after you've washed and shampooed your hair. Washed and conditioned, your hair, because the silicones and the sulfates in the shampoo stick on your skin, so you need to remove them.
Oh, wow, I didn't know.
Yeah.
All these
There's a light
things.
bulb.
Amazing.
Yeah.
Awesome. Thank you so much, Joyce.
That's all right.
Thank you, anyone who's joined us tonight. And this live stream will go up on our YouTube page, and then we'll post it up to our other social media platforms afterwards. So if you weren't able to see it or to stay around for all of it, you'll be able to check it out there. Do please go and check out Cianna's Smile and Look Good, Feel Good, as well as Joyce's own websites. And if you've got time after all of that, check out Pummel and Need as well. We'll be back in action soon, no doubt, all of us.
Yeah.
Excellent. Thank you so much.
Thank you, Joyce. And
thank you, Joyce.
we'll say goodbye to everyone and have a lovely Thursday evening. Enjoy the sunny weekend if you're somewhere sunny, and if you're not, I hope the sun shines soon for you. Take care, everyone. Bye-bye.
Bye. Bye.